One of the most common things that happen, especially in such road traffic accident, is bleeding. Bleeding refers to blood lost from the circulatory system. Blood loss may start as a trickle and if left unattended may even lead to heavy loss. There are two types of bleeding: internal bleeding, which is bleeding inside the body, and external bleeding, which is blood lost out of the body, put in simple terms.
Internal bleeding.
Now, let us look at what is internal bleeding. Internal bleeding is loss of blood inside the body, particularly in the chest cavity, stomach cavity, or muscles that may be caused by major trauma. Symptoms of internal bleeding include pale, cool or clammy skin, abnormal thirst, rapid or shallow breathing, pain or discomfort, nausea, and the victim gradually falling into a shock. More often than not, it may not be visible to the naked eye. If a person suffers internal bleeding, call 108 immediately for an ambulance and provide reassurance to the victim. Firmly advise the victim to visit the doctor. If the victim is unconscious, place the victim in the recovery position and do not provide any water or food through the victim's mouth. If the victim is conscious and complaining of thirst, give water to the victim.
External bleeding.
External bleeding. Let us look at what is external bleeding. External bleeding is blood being lost from the body through some type of open wound. There are three major types of external bleeding.
Incision.
1. Incision. This is a clean cut type of injury, usually made by a sharp object. Now, let us look at how to handle an incision.
How to handle an incision? Wear gloves on both hands to avoid risk of infection. An incision can be caused by a sharp object and results in a deep, clean cut through the layers of the skin, causing a lot of bleeding. If there is any object present in the incision, do not try to remove it, as it will cause even further damage and will increase bleeding. If the incision is deep, take a clean, dry cloth and wrap it around the wounded area where the object has pierced. If the incision is in any part of the body that allows you to tie a knot or compress, then choose to tie a knot 2 inches above the incision, not too tight. Abrasion.
Abrasions, often called grazes, are injuries that affect the surface of the skin, often caused by sliding falls or contact with moving objects or machinery, etc. Now, let us look at how to handle an abrasion.
How to handle an abrasion. Wear gloves on both hands to avoid risk of infection. If it is a minor wound, wash carefully with soap and antiseptic liquid diluted with water. Dry thoroughly and apply a clean, dry dressing. Use a clean, dry cloth or gauze to address the wound. Apply pressure directly over the bleeding point using your fingers or a pad. Maintain direct pressure. Elevate the bleeding point above the level of the heart until bleeding is controlled. Pressure should be maintained for more than 10 minutes to allow a blood clot to form. Do not treat the wound with pure cotton. Cotton fibers will stick to the wound, and on reaching the hospital, the victim will feel immense pain when the nurse tries to separate the fibers from the wound. Apply a non-sticky bandage. If you wish to use ice, do not use it directly on the wound. Make an ice pack for use. If the bleeding is on one of the legs, make sure that the victim is lying down. Apply pressure on the wound and elevate the injured leg. Bleeding on the head region. If the bleeding is on the head region, put direct pressure on the wound. If the victim is conscious, you can make him or her sit down. If the victim is unconscious, do not make the victim lie down. Amputation.
An amputation is when a part of the body, a finger, toe, or hand, for example, has been partly or completely severed from the body. Now, let us look at how to handle an amputation.
How to handle an amputation. If any part of the body is amputated, compress the area directly with a clean, dry cloth. To maintain the compression, tie a bandage around the amputated area. There will be excessive bleeding, but once the cloth has been soaked through, do not remove this first cloth, but add another clean, dry cloth on top of the existing one and carry on again if the same happens. The amputated limb or part will also have to be handled with care since there are chances for reattachment. Do not wash or clean the amputated part. Seal in a plastic bag or wrap in waterproof material. Place the amputated part in a cool environment. Do not freeze the amputated part by directly placing it on ice. Deliver the amputated part along with the victim to the hospital.
Generally, it is assumed that only a head injury or blood loss from the head is considered dangerous. But there are 4 other areas in the body that can end up leading to heavy blood loss and should not be ignored. Those are the abdomen, the belly region, the chest, and finally thighs and the leg region. If the bleeding occurs in these regions, the victim's life is in danger. These body parts cannot be raised above the level of the heart, and the size of arteries are big. Therefore, a lot of amount of blood will be lost in a very short time.
Nosebleed.
Nosebleed is a very common condition, especially amongst children, where blood drips from the nose. It can have causes that aren't due to any underlying disease. Blood vessels in the nose are very delicate and they can get ruptured easily due to a variety of reasons like injury, picking nose with sharp fingernails, high humidity, or even extreme temperatures. Now, let us look at what to do during a nosebleed situation.
What to do during a nosebleed. With your index and thumb fingers, pinch the tip of the nose firmly for about 5 minutes. Ask the victim to breathe through the mouth. Help the person to sit straight and lean forward slightly. After 5 minutes, check if the bleeding has stopped. If not, continue to pinch the tip of the nose and lean forward while you may take the victim to the hospital for any further treatment. Do not lift the head back as the blood might flow backwards and cause a blockage at the back of the nose and start to clot. This will cause an obstruction and worsen the situation.
Remember, your safety is your responsibility. It is advisable to avoid direct contact with blood. In case you had used gloves, it is important how you remove the gloves and dispose it. Now, let us take a look at the proper disposal method for gloves.
Gloves removal method. To dispose the gloves properly, pinch the outside of one glove near your wrist. Carefully pull the glove off, turning it inside out. Hold the glove in the palm of the still gloved hand. Slip 2 fingers under the wrist of the remaining glove. Pull the glove until it comes off inside out. The first glove should end up inside the glove you just took off. Dispose of the gloves safely. Always wash your hands after removing gloves and before touching any objects or surfaces. Gloves can have holes in them that are too small to be seen. Chapter Summary.
In this chapter, you have learnt what is bleeding, what is internal and external bleeding and the first aid for it, nose bleeding and the first aid for it, gloves removal method.